Okay, please, guys, if you see me on the Facebook Live, please, guys, let me know. Thank you very much. Guys, am I audible to everyone? I'm on Facebook Live right now. Please, guys, let me know. Today's session, as I mentioned before, it's a very special session. Why? Because it has two parts in it today. The first part, we have one of our champions. She's a queen today. She has passed her exam last week. And then definitely she has passed part one as well. I would say before she's doing part two. And then today she's gonna give you good hints regards how to pass part one and part two. By the way, the queen today passed her part one from the first attempt. So guys, please guys, before I say anything, guys, am I audible to everyone? Let me check this. Let me put this one down here. Please, guys, if I'm audible to everyone, please let me know on the Facebook group. On the Facebook page, sorry. By the way, guys, for everyone, we started to do articles for you. Please, admin, if you are there, if you can send them the link for the articles in here on Zoom chat. So guys, what you can do is you can read these articles. It will help you to understand more about ADC process. Okay, guys, before I start, I would love to check on every one of you. Dr. Saida, how you going? Dr. Shama, Dr. Sondos, Dr. Ramin, Dr. Yamana, Dr. Iman, Dr. Winnie, Dr. Saida. Very good, Dr. Saida. You're doing great. Dr. Junaid, Dr. Ankita, and every one of you guys. Okay. Now, we all understand that the EDC journey is difficult and hard. And I understand all the time, every night, I know this very well. I keep telling myself, you know what? This exam really hard, and this candidate should get the best help ever in this world. And I feel sorry when I see some candidates, they're really a mom or a dad, and they work in clinics, and then they don't have a clue how to pass the exam. That's why, and because we are the biggest family in Australia and over the world, regardless whatever attacks we had recently, and then people really being paid, we still the biggest ever, and we're gonna be the biggest ever. Saying this, as a big family, our members, our family members, always happy to come and help you guys. And always, we are very proud of them because they never go away, they never vanish, they always here around you to help you. That's why, from the bottom of my heart, I want to congratulate Dr. Lakshmi Raj for her amazing achievements, and that she passed her part one exam in the first attempt, and now she passed her part two, and she's waiting for her registration. She's here today, guys, to give you all the help you want, either in part one and part two. So please, guys, everyone say congratulations to Dr. Lakshmi, guys, please. Dr. Lakshmi, can you hear me?
Yes, thank you so much, Doctor. Thank you for having me today.
Thank you very much. Thanks very much for accepting No, actually, I think you are the one even has, I believe so. You are the one has offered to help the candidates, and I see how good you are, and with big heart.
Oh, thank you.
Thank you very much for coming and help the candidate today. We are a big family, and you are the queen today. I want you please to share your experience. How did you pass part one, and part one? How you feel after you pass the exam?
So, firstly, I'd like to thank you for being a very important part of my journey. And so, as Dr. Bedo said, I did my part one with Dr. Bedo, and I passed. I started my journey, did preparation for about 5 months, and then I gave my part one, and I passed it my first attempt, and then part two, which took a while, but still Dr. Bedo was there, and all the tutors. So they've been constantly helping, and now yes, so everything feels so relieved.
I'm very happy, Dr. Raj, for hearing this from you. So now, if you want to give advice for part one candidates, what would be advice?
So with part one, firstly, doctor, as you always say, so even though it is just theory and scenario based questions, all I want to say is each question is like a scenario happening in a clinic where you work as a dentist in Australia. So imagining things like that is the most important thing. And Dr. Bedo will train you really well regarding that as well in his course. So, and also preparation. And preparation for part one is really important to know what to learn and also how you can ace the questions, to be honest. And for those who have already been in Bedo's course, Dr. Bedo's course, you might already know the structure and everything. But he will also tell you, even though we'll be reading full books, he will tell you how to read them. Because even though we are all dentists, from our own country, but it's very different in the Western world. And Dr. Bedo will help you get there. That is for 100%. Dr. Bedo, please interrupt me if you'd
Yes,
like to say
thank you
something.
very much. Yes, no, no. I'm very look. I can hear you properly. Everything's perfect right now. Thank you very much. I can hear you properly.
Okay.
And thanks so much for this. Look, this is a trust always I tell the candidates. We have like look. I don't want to really mention some names because I believe there is about 100 candidates right now on Zoom and Facebook. So I cannot mention every single candidate name, but believe me, every candidate here in this session, I know them personally. I know the progress, and I know how much they trust the journey, how much they trust themselves, how much they are confident. And this is a big motivation for me. As long as I see this coming out from the candidates, I always feel very happy and I feel always motivated to help them more.
Yes, yes.
You're totally right about this.
Yes, doctor. So, because why part one is important is that's when you're actually getting introduced into the whole process and what they expect from you and what sort of questions you are exposed to. So, that's all what you will see in part one. And with that, please just go with Dr. Bedo's guidance and trust him completely because I know there could be a lot of distractions, but there is no second thought about it, honestly, for part one, because there are a lot of materials that are, around Facebook or many social platforms. But sticking to one person and reading their articles and following them will give you a very clear idea. Basics, for example, from reading Bitewings, he's got brilliant concepts, and I still remember that even after 2 years. So it is something that you will remember for life. Few concepts that he'll teach you, which are also very helpful in part two, but it's a bit more comprehensive in part two. That's the only difference. But with part one, yes, regarding the course itself, so it is very much structured where you, so he was, things might have changed now, but when I did the course, you do not start by doing any mocks, which I think is really important, because when you start reading and take mocks slowly, that's when you realize how to really answer questions. And I learned it after 3 4 classes with Dr. Bedo. And every class in part one with Dr. Bedo is really really important, and everything he says is like Bible. Just write it down and it will help you always. So with part one, that, and then you, I mean, many of you might have already experienced it, like when you will feel a bit lost when you're getting closer to the exam. He's also got a plan for that. Like, I think it's called the golden plan, I'm not sure, but that is just perfect for you to refresh and what needs to be refreshed in the last minute. And going subject wise, so he will get every subject, have clear all everything, every doubts. Whatever you need, you can ask him, you can reach out to anyone. That is another brilliant thing with Dr. Bedo, is that everyone in the academy are available to you anytime, with anything, with any question, regardless of exams or whatever it is. So with part one, all I want to say is please focus. And again, with the whole ADC process, you will have to invest a lot of time and money. That's all, Dr. Bedo. Do you want me to add anything to it?
Yes. How long did you take the course? How long did you do the course for? Or how long
So
did you prepare for
yes,
the
so
exam?
I took the full comprehensive course for part one, and I think the course started in September, but I managed to do it only from October. So I did my preparation for about 5 months.
Okay, about 5 months, right?
Yes,
I think like the same time like now, because I believe now for the exam for September candidates, I
correct.
believe they actually need for 5 months as about 5 6 months right now.
Yes,
If you want really 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 find them, like if you want to really tell them very very important advice, what can be for part one for now at least?
very very
Be the
important
most, yes,
advice.
the most important advice is
The most important advice, Dr. Bedo, is to understand how everything works with the or how dentistry works in Australia.
okay.
Yes,
Like
that is,
clinical, like what's the clinical judgment and critical thinking, right?
yes, definitely. Because in part one, though we are not doing anything clinically, that theoretical knowledge itself will, if you imagine, like you say, if you imagine yourself as a dentist working in Australia, how would you answer that question?
Okay, very good. And that's why every Tuesday, like after we actually you help the candidates with tips and tricks for part one, part two. We're gonna have this session right now to teach them how to think like Australian dentists. The things really are gonna help them to answer the question. That's exactly what I'm telling them.
Yes.
Okay, do you know that we do this? And by the way, I got surprised when you said I didn't do mock in the beginning of your course because everyone now love to do mocks in the like even now, like we haven't even started that much, and
No,
everyone now asking for mock.
no, Dr. Bida. So what I remember is, because it's been 2 years, I think.
Okay,
So when we started the course, you had one mock, okay, where we didn't know anything, right?
okay,
It was a TG mock, and
okay.
you asked us to see the improvement after 2 or 3 months doing another mock.
Yes.
So that's what I remember, because we did not, because when your mocks are really different, and the mock discussions as well, it's not just looking at the answer and then seeing, oh, it's not like that.
Okay. Okay. Yeah, that is good then. Wow, I think I think that is even was much better then. Only two mocks in 2 months. Wow, that is very good then. These
Yes.
candidates now, I think they are pampered right now. They spoiled right now. They mostly have a mock every 1 week or 2 weeks. Guys,
Or
no more mocks for you guys then.
Oh, really? Because no, I clearly remember. After every subject, once you have finished it, we have a mock.
Mm. Okay, that's very good then. Okay, guys, no mocks for you. Dr. Lakshmi said no more mocks for you guys. What do you think? No, definitely. Look, I think now the candidates actually need to go through more mocks, Dr. Lakshmi, because I think now getting a little bit more competitive, and
Yes,
that's
definitely.
why I believe more mocks will be very helpful to them.
No,
Because
obviously, doctor. If you have said it that way, then yes.
yeah, because I know like what's going on right now,
Yes,
and
it
more
keeps
mocks are going
changing
to
as
make
well.
them yes, more mocks are going to make them even much better. I would say.
Yes, yes.
Because there are lots of new topics right now, lots of new things. I want Ray to cover all the things. So you're totally right about it. Do you think like the course has been finished on time and there was enough to you, or what do you think about it? Or you should have studied for longer than 5 months. What do you think?
Um, Dr. Bedo, with me, I was actually working full time as well while
Okay.
I was doing part one, which was difficult for me, but I never failed to attend your classes twice a week. And I'm in New Zealand, so there is a time difference as well. But the thing is, you you have plans with subjects, and I tried really hard to reach that, but sometimes I couldn't cover the portions that you the time that you gave us. But and then when we asked you for more time, you always adjusted it to according to the plan, so it is very flexible, and he will accommodate to all your needs. Or if you're struggling, for example, we struggled with prosthodontics so much, and you had extra sessions, and also you gave us some extra time to actually go through some of the chapters. So with regards to timing, I think everything is just perfectly set in his course.
That is very good. Then I think this is I would say a relief to all the candidates here right now, so they shouldn't be under stress. Under stress, even if they cannot finish the task any time, because I do it in purpose. I always say
Yes.
this. Do you
Yes.
remember why I do this? Why I push you? Like, did you know my justification at the end? Why I'm making the little bit you guys to study a little bit more? Because I push you, right?
Yeah.
I don't want to see anyone lazy. I want
Yes.
all of you guys be pushed because I always believe in this. When we come out from our comfort zone, we can grow. The problem is if you take things like very lightly or slightly, you're gonna forget about your dream and you never get there. So that's why, for example, instead to give you 50 pages of therapeutic guidelines, I say 60, 70 pages. I know this is 10 pages extra, 20 pages extra, just only because I want you to finish 50. My plan is to make you to finish 50. But to make you finish 50, I give you 70. Because I understand about human psychology. I'm a human like you. My plan. Right? So that's always the way I plan it. Okay. Okay. Dr. Lakshmi, what is your experience about part two? Guys, by the way, anyone here guys want to ask Dr. Lakshmi any question, guys, please? Dr. Lakshmi, can you hear me?
Yes, doctor. Yes.
Okay. So we wait now for the candidates if they ask any questions.
Sure.
Otherwise, we can move on then. Everyone say it must be more mocks. No, it's helpful mocks. How we need more mock to see our improvement. That's what we can get from the candidates. See, I told you, everyone actually asking for the same thing. They all want more mocks. Okay, this is great then. Okay, guys, seems like no one has any doubt or no one has any question for part one. Let's move now, please. What's your advice for part two, Dr. Lakshmi?
um, for part two, doctor, I think the first thing is to plan well
Yes.
and to understand what are the aspects of part two. Because even though we will know what it entails and everything, there are a lot more to it, to each and every part of part two, right?
Yep.
Yeah. So, firstly, please plan how you are going to do everything. As you might all know, there are three parts to it. Um, so, regarding OSCEs, the communication OSCEs, it is nothing but it is a very natural way of communication, how you would talk to your patients every day in the clinic. That is all it is. But you do need a solid foundation, which again you will have in Dr. Bedo's course, with cases and everything, whatnot, everything written very detailed. But it is not only reading that and just talking about it. It is how you manage the patient in the exam or the examiner. And also answering all those spontaneous questions they ask. It's not only answering whatever questions you've already read. With OSCEs, I think, and also managing stress, which is really important. And then moving on to technicals. With technicals, firstly, again, plan very well. See where you are. So, at what level you are. That is what will judge how much practice you need with technicals. And also, as everyone says, understanding the criteria. But what is more important is also to understand, what if you don't achieve the criteria? How is it going to harm the patient? Which is something I understood a bit later after I started. But that is one way of thinking, like, would you do a work like this if you were doing it for a real patient? That is one way to think when you're always doing technicals. And again, getting them assessed and achieving the criteria, of course. And the third thing is skilled OSCEs. With skilled OSCEs, it's really about doing the right thing, but practice is the key for skilled OSCEs. Practice and again, stress management. That's all, Dr. Bedo.
Thank you very much. That's great. Then, and that's exactly what we do right now. Like this session today, it's more about to discuss this clinical information, critical thinking, and all this stuff. And by the way, this I wish if the candidates understand how important are the things we discuss right. They will know how important it is. Once you sit the exam, once they pass the exam, they know maybe after they pass the exam, but they need to know it now as well. But I see the champions here right now, they attending and they really understand it. Because definitely we need every one of them pass the exam. That's why.
Yes.
Dr. Lakshmi, you know how much I'm very happy for you, and I'm very much proud of you, Doctor.
Thank you, Dr. No, thank you so much.
Thank you very much. And as I always say, it's not. I always say everyone gonna. Do you remember what I always say? Everyone going to do what, but they should do what?
Everyone should stay in the process and everyone will pass.
Thank you very much. That's exactly what we say. I always say everyone gonna pass the exam as long as they don't give don't give up. Now you can see it, right?
Yes.
I'm very happy. I'm
Yes.
very happy for this. This is really great. Okay, guys, let me check if they have any question. Okay,
Yeah.
let me check this, please. If you have any question, replace. Uh, reading. Because now after this, we gotta discuss the clinical case. Any questions here? This is a Facebook. This is the page right now. That's a live. Okay. Okay, there's a question here, Dr. Bedo. Should I start right now? My exam is in March 2027. Should I start right now? Should I wait? What do you think, doctor?
The sooner the better.
Ah,
The sooner the better. It's always,
sooner is better, right?
yes, yes, yeah,
Okay, this is always
definitely.
my opinion. This is always my opinion. You know what? I always tell this candidate. I always tell them the it's all about it's all about the effort you put. If you start to put effort right now, the journey will be less stressful than if we
Yes,
just start closer to the exam. So the best
yes,
way is just to start as soon as you can. Soon as better. I totally agree on this.
yes, definitely.
Okay, let me check again. How long Dr. Lies asked question. How long she prepared for part two? Dr. Lakshmi, how long did you prepare for part two?
Um, I would say it took about, I mean, to give my first attempt, I took only 4 months.
4 months.
But
Yep.
yes, yeah. So I gave it immediately after I passed my part one. So I prepared for 4 months, um, which I always think I should have started a bit earlier. My preparation, as I said, the planning and everything. But otherwise, to actually complete it, it has taken me 2 years actually.
Yep. Okay. So, Doctor, I believe if you ask me the same question and based on Dr. Lakshmi's answer, I would say maybe 5 months. Again, like part one, 5, 6 months will be okay. Right, Doctor?
Yes.
Okay. That's very good then. Dr. Riti says, Dr. Riti Varma, I'm giving exam on September 2026. All the best with it, Dr. Riti Varma. I think joining the session right now, that is the best decision, Dr. Riti Varma. Okay. Okay, Dr. Bedo. Okay, yes. Okay, I'm just going around, 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 around. Okay, that's fine then. Thank you very much, Doctor. Dr. Lakshmi, I'm very proud of you. Thank you very much.
Thank you, doctor. It was
Thanks
my
for
pleasure.
coming today and help everyone.
Thank you, no
By the way,
problem.
now we're going to discuss one clinical case for all these champions to help them how to think like Australian dentists. If you want, I know, definitely after you pass the exam, most probably you're going to be busy with other things. But if you want to stay and then listen to the session, will be great. Otherwise, definitely, I wish you all the best.
Thank you, Dr. Bedo, and I wish everyone all the very best.
Thank you very much, Dr. Lakshmi. And I really appreciate this. All the best to you then.
Thank you, doctor.
Thank you very much. Thank you. Okay, guys, let's now share the screen. And then please, guys, for the champions who are really born, please, guys, say congratulations. Thanks very much to Dr. Lakshmi, please, guys. Thank you very much, Dr. Ramin. Thank you very much, Dr. Riti. Thank you, Dr. Les. And you are saying congratulations too. Thank you very much for this. Okay, 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 okay. Let me share the screen right now. And believe me, guys, you don't know how much I love our champions. They are real human. They really have big hearts. They help each others. They after before they pass the exam, like I remember Dr. Lakshmi in part one. She was helping everyone. She was, if someone asked questions, she used to answer straight away. She used to ask questions, motivate the people to ask questions. If someone is stressed, that is always happening. Even this batch, previous batch of September, was the same in March. And September right now, the people even started to do this. Look at them. Look at you guys. That's why we love our champions. That's why we put all our efforts toward every one of you guys. I don't mind to work day and night for you. You know what? Look at this. I did session on Sunday for part two. I did session yesterday for part one. Now I do session for part one and part two. Tomorrow I'm going to do session. Tuesday there's a session. Thursday there's gonna be session. Every night. In the morning, either in academy or clinic, at night. Why? Because you really deserve this. You really deserve to pass the exam and have future life and big dreams. Okay, guys, now who's going to do role play? Who's going to teach us today how to think like Australian dentists? Who's going to help us today to answer the questions in the right way? Who's this? Please, guys, raise your hand. If you are on Zoom, you need to be in Zoom. And please raise your hand so I can unmute you. Let me check this. Or maybe on Facebook if you want to comment so I can find you. I see Dr. Sanchari. Hi, Dr. Sanchari, how are you going? I see also Dr. Nav Hara.
Hi, Dr. Bedo. I'm good, thank you. How are you?
Thank you very much, Dr. Nav. Sorry, Dr. Sanchari and Dr. Nav is here as well. Hi, Dr. Nav.
Hi, Dr. Bedo.
How are you going, guys?
Good, good. How are you?
Good, thank you very much. Okay, guys, one of you gonna do the role play today. Any one of you guys didn't do the role play recently? Who's guys has done the role play recently, guys?
That was me, Dr. Bedo. So Dr.
You did one
Sanchari can have
recently,
a
right?
word. Yeah.
Thank you so much.
Okay, this is great then. Okay, guys, let's even see who's actually who else, guys. Give me 1 second, please, to see Dr. Amna. How are you going, Dr. Amna?
I'm good. How are you?
Good, thanks, Dr. Amna. This is great then. Let me check on the Facebook as well. Is anyone interested? So we can do it. Okay, let me check this. Give me 1 second, please, guys. Okay, just put this one down. This one down. Get this one down. Okay. I see a comment from Dr. Okay, congratulations. Dr. Nandini, I trust Dr. Bidu even more than I trust. Oh my God, that is big one. Dr. Nandini, I see Dr. Nandani says, I trust Dr. Bidu even more than I trust myself with this exam, seriously. Thank you very much, Dr. Nandini. Thank you, Dr. Sanchari. Dr. Les, no, we love mocks. Okay, no more mocks for here. More mocks for me, for here, for you, yes? Dr. Maria, okay, Dr. Ritivama. Congratulations. Thank you very much, guys. Everyone say congratulations. Okay, Dr. Mustafa Tai, thank you. Congratulations for passing. Yes, definitely. I agree on this. Okay, Dr. Rehan asked question, how can I join the course? Please, admin, if possible, you can answer, reply Dr. Rehan. He says, how can join the course? So please, guys, help him. Now, the case. Dr. Amna, did you do role play recently or Dr. Sanchari? Which one?
I think I did one in March.
In March? Okay. Dr.
Yeah.
Sanchari, when was the last time you did?
Probably last month. I don't think I have done any in March.
Like in maybe Feb?
Probably, yes.
Okay. So okay, guys, let's make Dr. Sanchari do the session today, and you Dr. Nev and Dr. Amna, and then we can do it next time. Okay?
Yes, Dr. Bedo. Thank you.
Thank you very much, you guys. I appreciate this. Okay.
Thank you so much.
No, thanks very much, you guys. Dr. Sanchari, this is a surprise. Surprise.
Yes, Dr. Bedo. Please surprise me.
Are you scared? Seems like your voice scared.
I get very nervous at the end moment when I see the
Oh,
case.
no, you know my way. You
Yes,
remember what I always tell you?
you have asked me to be brave. I will be brave.
Yes, you remember in academy what I always tell you in academy.
I need to focus.
You need to focus and you need to be brave, right? And you need to be strong. The word fear, we don't have it. Do we have the word fear in our dictionary?
No,
Nope. Why we should be afraid? From who? Why? What's the reason? Right? Be strong. Trust yourself. You are perfect. You know the knowledge. You know the information. You just only can talk together, me and you, to find out answers for every question. Okay?
okay.
We need to be smart. The way to answer the question. That's it.
Yes,
Okay? Very good then. Okay. Now, that's a clinical case. Can you look at it right now?
I can see it. Yes.
Okay. Would you like to have by the way, guys, this case we're going to explain more about it. It has two main parts. It has a perio part and prosto part. The perio part is about the diagnosis, and prosto part is about replacement options. So it has two. By the way, it's not easy. Like when I say the word replacement options, not easy as you think. You must really have your own critical thinking, the way that you need to choose on the right, because you're going to get surprised with the options. You're going to think, oh my God, really? Is this the correct options? Oh, the first time I knew this, for example. Okay. Now, can you please read the scenario to me, Dr. Sansari, loudly?
Yes, I can. A 62-year-old male patient, Mr. Daniel Roberts, present to a general dental clinic in Melbourne, Australia, requesting extraction of his loose upper front tooth. He has a history of type 2 diabetes mellitus, is non-compliant with metformin, and has not seen his GP for several years. He smokes around 15 cigarettes per day and drinks alcohol regularly. He reports irregular dental attendance with his last visit over 5 years ago. Clinical examinations show generalized gingival inflammation, periodontal pockets of 6 to 9 millimeter, and grade 3 mobility affecting several teeth. Radiographs reveal generalized severe alveolar bone loss. Bolpart. Explain the diagnosis, discuss risk factors, outline appropriate management, replacement options, and manage the patient concerns.
Thank you very much, then. Can you? Because yesterday I gave the candidate similar, but not exactly the same things. It was Gigi case. Do you remember the Gigi case? I think you have attended one time Gigi case. Do you still remember it? No? Yes?
I have attended before. Yes, I have.
Okay. So yesterday I discussed the Gigi case with the candidates with a little bit of changes. So it's something similar right now. So being a dentist, when you look at this scenario, can you please tell me what is the patient chief complaint here?
So the
The
patient's
reason for attendance today.
The reason for attendance, he has a loose upper front tooth and he wants
Thank you
it
very
out.
much. So now we have a lot of other information here. Can you look at this? Lots, right? Can
Yes.
you tell me other findings, please? Apart from the loose upper front tooth, give me more findings.
He does have generalized gingival inflammation, pockets, mobility in several teeth, and bone loss as well.
Okay, but why he is today? What is the reason he's in the clinic today?
But
Is that because he has gingivitis?
no,
Is that because he has severe bone loss?
no, he has localized bone loss in the upper front tooth,
Good.
causing it to be mobile, and he is not happy with the tooth there and he wants it out.
Yes, you want extraction, right?
Yes.
So now this is the reason today. So if you're not going to address this today, we'll be able that it means like you'll be able to build up rapport with the patients.
No.
No. So we need to focus on this part. What else do you think? What is the second reason that the patient attends your clinic today? After extraction of upper front tooth, what else after this? You may think it's
Mhm.
really quiet from this patient as a concern. What could be the concern of the patient in this case?
After extraction of a front tooth, the patient can't go without a tooth. So we need
Very
to,
good.
yes.
So what we need to do after this?
So we need to explain replacement options.
Okay, what was the replacement option? Only the immediate or immediate and the long term? Which one? Or both? Or one? Which one?
Both immediate and long term, depending on what the patient would like to hear more details on.
I'm very proud of you. Very smart. Very good then. Now,
Much.
what are the things you may think now you need to discuss as well as a bold part?
As a bold part, I would like to discuss the risk factors, which is causing the gum disease and helping it progress. I would let the patient know that he would have to think about quitting smoking as well. Some counseling there, as well as his diabetes. We need to make sure he is regular with his GP and what his blood sugar is looking like at the moment. We need to make sure he is taking his medications as well. Just
Okay, can you count them can you count for me these risk factors, all of them, one by one now?
okay.
Oh,
One.
sorry, the risk factors, guys, we call it something different, guys. Please, guys, help Dr. Sanchari to organize her ideas. Guys, we mentioned the risk factor, we call it also some different names. So, Dr. Sanchari, how we call the risk factors? For example, diabetes and smoking, how we call them in perio cases?
Those are the factors with
Something with MOD,
modifying factors.
modifiers, right? Modifying factors
Yes.
or modifiers, right?
Yes.
Because if we modify them, that will help us in our grade, right? Grading.
Yes.
System. Good. So we have now two modifiers. One is diabetes, and the second is smoking.
Yes.
Okay, there is another risk factor here, which is drinking alcohol. What else do you think as a risk factor based on the information provided? Maybe oral hygiene?
Oral hygiene as well as irregular dental attendance.
Yeah, which is oral hygiene maintenance, right? If you have a
Yes.
car, you need to maintain it. You have a teeth, so you need to maintain your teeth, right?
Yes.
Very good. So now, do you really need to ask me more questions regarding the risk factors or modifiers, or that's enough for you? More than enough. More than enough.
I think more than enough.
Enough.
Could I
More
ask
than enough.
about family
Tell me.
history at all? No.
Okay. I will tell you maybe. Not sure.
But not that it impacts my treatment or management plan anyway, either.
Yeah, but if you want to ask, I don't mind it. It's still a relative, so it's fine then.
Okay.
Okay.
All right.
Okay. Good. And then give me diagnosis. So now in your case, one is extraction part, two, diagnosis, three, risk factors, then replacement options, and that's it. That's what you need to do. How many points right now, mainly?
Extraction, diagnosis,
Two,
risk factors,
three, and replacement
option.
Yes, immediate and long term. Okay?
Immediate
Short term and long term. Okay?
Yes.
That's it.
So extraction, diagnosis, risk factors, replacement option.
Yes. This is everything now in this case. No
Yeah.
more. And the part of management as well, to manage the perio disease, diagnosis and management for the perio. Like who's going to do the treatment, for example, if it's generalized all around. So who's going to do the treatment for generalized? Okay, but just touch with this point.
Okay. Yes.
Okay, so now 5 points in total.
Yes.
Extraction for the upper front tooth.
Mm-hmm.
Diagnosis for the upper front tooth and overall gum disease, management of the gum disease, who's going to treat it and how, the risk factors of the gum disease, including this tooth, and then replacement options. Touch base. No need to talk a lot in every single point.
Okay.
Okay?
And I will be referring to a gum disease specialist.
Yes. Very good.
Thank you so much.
Let's now do this right now. Let me just give you, how many minutes do you want to read the case? I think 2 minutes is enough now because we already discussed everything.
2 minutes is enough. Just another question. I don't see any radiograph or...
How come there is no radiograph I think you need to get your eyeglasses then. Because I see in your photo, you wear black glasses.
I do
Like
see the radiograph now. Okay.
okay, can you please remove
Much
your
clearer.
glasses, please?
Okay. I do not have any glasses now. Okay. Now I see the radiograph. Perfect.
Okay, thank you very much. Okay, let's now do this. Timing. Pause.
How do I address you?
I'm Michael. Easy.
You're Michael. Okay.
Let me check this one. Always I have trouble with the timing sometimes. Hide meeting, annotate, pause, participant,
I don't
hide
see the
meeting.
specific pocket depth for the front tooth.
Which one?
The loose upper front tooth, the pocket depth around
69
it.
millimeter. 69 millimeter. 9 to 10. Very deep one because anyway it's grade 3 mobility. Severe
Yes.
bone loss.
Yes. Okay.
What I'll do is right now I stop sharing for a second. Sorry guys for this.
That's
And
okay.
then yes, and then I will get this more, and then more I can see apps. On apps we get a timer. It takes like a couple of minutes. No, actually less than this. Timer still loading. Timer, 2 minutes for you, okay?
Okay.
All the
Thank you.
best to you then. Let me just set up 2 minutes, 2 minutes, 2 minutes, 2 minutes. Perfect. Start right now. And then share again the case.
Yes.
Okay. All the best to you then.
Thank you so
By
much.
the way, after this, we gotta discuss the options, the replacement option, the management as well. Okay.
Okay. Thank you.
No problem. Thank you very much. All the best. Okay, guys. Also, Sunshine takes about 1 minute and 37 seconds until she organized her ideas, and then there gonna be lots of questions. Every single question, guys. I'm going to ask her. This can be easily one of your exam questions. Easily, either part one or part two. You will be surprised, guys, with the management of these cases. You may think, for example, these cases can be answered only in one way, in different ways, and then the replacement option stuff. But the question will be asked. It will be very, very specific type of questions. Doctor, you can start right now.
Okay. Thank you so much. Thank you so much, Michael, for seeing me today. I'm Dr. Sanchari, as you know. I have done my examination. Could you please elaborate about the concern today?
Yeah, doctor, I'm here today because I have one of my top left-hand side front tooth, and it's too loose, doctor. It's very wobbly. I really need to go. And not sure, doctor. What should I do after this?
I see. Absolutely. I have had a very good look around your teeth, and we have taken an X-ray here. There are a few things I would like to speak about, which can be one of the cause why your tooth seems to be loose there. Is it okay? Would you like me to explain first?
Yes, please, doctor. Just explain to me. Look,
Mhm.
I need just to know first, doctor. Will you extract my tooth today or next time?
We can extract your tooth today, depending on how your medical history and everything is looking. Is it okay if I ask you a few questions and then I can let you know if we can take it out today?
Okay, that's okay then.
Yes, that sounds perfect. Okay. Looking at the full mouth X-ray we have taken here, do you see these are your upper all teeth and the lower teeth as well.
Yes, doctor, I see them very, very good. Yes, very clearly. Yes, that's
Perfect.
my
And
upper and that's my lower. Am I right?
yes, all the upper and lower teeth. And do you see a thin white line around the neck of the teeth?
Doctor, do you mean this line, right?
Yes, a line, and then you have the white shadow below it. That is your bone level. So that is, we are looking at
Hmm.
your bone.
Okay.
Yes. So what I see here, you see they are a bit far from the neck of the tooth. So you do have a decreased level of your bone as well as your gums. So, and I see there is some space between your teeth and your gums while I was
Doctor,
checking
look,
out.
doctor,
Yes.
thanks so much for this. But why this bone? You how you call it? You call it bone loss. So, doctor, how this bone loss or decreased level of the bone has happened?
Yes, so there are multiple factors that can be affecting this condition which you are having here. This is a kind of gum condition we are looking at. So, how long have you been aware of this gum condition?
Nothing. Just only a few days ago, while I was biting on apples, I found a bit bleeding coming out from the gums. That's it. And by the way, there's
Mm-hmm.
one of my, as I said earlier, there's one of my top left hand side tooth. Actually, it's very wobbly, and this is maybe about 2 3 years ago. It started to be wobbly, but I'm very busy at my work, doctor. That's why I have no time to come and see you.
Right, right. That's understandable. Life can get busy as well. And see, this is the thing. You have this gum disease. It's been ongoing for a while now. Have you had any pain, any sensitivity at all?
Um, Not really. I'm okay.
Okay, that's perfect. But you do have some bleeding while brushing. Is that right?
Yes, doctor.
Yes, while I was examining your gums today and I was looking around your teeth, I did notice some bleeding as well, which means
Doctor, sorry,
your, yes,
sorry, doctor. I asked you a question. Sorry, I didn't get the answer. Doctor, what was the reason behind this, doctor?
your bone loss. Yes. So your bone loss can be because of the gum disease, which we are seeing, that is your gums and bones seems to be a bit inflamed because of,
Okay.
yes, there is bacteria there as well as food getting stuck, becoming something known as plaque. And
Doctor, I brush my teeth all the time. I brush my teeth 3 times a day, doctor.
that's perfect. And have you been flossing as well?
No, I forgot sometimes. I won't get busy, doctor.
Right. That is lovely that you are brushing 3 times a day. I would really like you to floss as well, at least once a day, because that helps you keeping food.
What else,
Um,
doctor, apart from floss?
Apart from floss, you can use something known as interdental brushes, which can easily go between the gaps between your
So, doctor,
teeth.
do you think if
Yes.
I do flossing every day or brushing between the teeth each other, that would be enough? And then I will not get any bone loss or gum disease, doctor?
No, Michael, that won't be enough, which is why I will be letting you know other things that you will have to be taking care of. So, the gum disease, what I'm looking at is something known as chronic because it has been ongoing and it has been affecting more than 1/3 of your teeth you have in your mouth. So, that will be generalized. And because it is affecting the bone and the surrounding structures of your teeth that is inflamed, the gums and the bones, it is known as periodontitis. So we are looking at chronic generalized periodontitis. And
Doctor, I have read
yes,
article recently, and then they said they changed this type of names and stuff. There's any new names, doctor, you can guide me because I've been now searching for this condition in Google, and then they give me different names, something called staging and grading. What is exactly, doctor?
so we do stage and grade the disease to understand how severe it is to stage, and the grading would be how fast it is progressing.
So, doctor,
Uh,
again, doctor, my question. I need you to answer this question because that's the third time I ask you. What do you think has happened that I end up with this bone loss, doctor?
So multiple factors, including the bacteria, the food getting stuck, as well as do you
Apart from
smoke at all?
bacteria and the food and flossing and brushing, what else, doctor?
Sorry, if you don't mind me asking, do you smoke?
Yes, doctor, and I put this in my history before I come to you. You can look at the my history, doctor, and you will understand this. I am a smoker, and also I have uncontrolled diabetes, doctor, too.
Absolutely. So I was speaking about the staging and grading. So grading depends on two factors which significantly affect your gums and the bone level as well, causing the disease to progress really faster. That is your diabetes. We really need to make sure your blood sugar is within
Ah, okay.
control.
So
Yeah.
diabetes could be the reason then, right? What else apart from diabetes, doctor?
Yes, one could be the diabetes and one other could be the smoking as well. How long have you been smoking for, Michael?
Ah, that was about 15 years ago. But do you know, doctor,
Mm-hmm.
I may quit. But doctor, which one of these really has more a damaging effect on my gums and my bone? Is it smoking or diabetes?
It's a diabetes, Michael. So have you been regular with your GP? When was the last time you saw him or her?
That was about a year ago. But why, doctor, do you think diabetes has more effect than detrimental effect on the teeth than smoking, doctor?
Michael, diabetes is raising the levels of sugar in our blood and it is affecting all our organs, not only our teeth, in a very systemic and generic level. So, we really need to make sure the sugar is within control. So, when we have higher levels of sugar for constantly longer periods, that affects our gums as well, that delays healings and you're more prone to any infections as well. Is that making sense, Michael?
You mean like the repair itself, the repair for the any gum inflammation or any gum disease will be not healing properly, right? Okay,
Yes,
doctor, I
which
got
is
this
why,
point right now. Doctor,
yes,
back again to the main point, extraction. Are you going to do extraction today? You're going to extract my tooth?
absolutely, we can do the extraction, but it is your front tooth. I would like to replace it as well. Would you like me to explain you a few things?
Yes, please, doctor. Yes,
In
just tell me what are you going to do for replacement, either immediate, like now, or maybe next time, and when you need to extract the tooth. That's only what I need to know.
Michael, how soon do you want your tooth to be replaced? What do you do for work?
You are the boss. Tell me. Actually, I don't want to really lose my tooth. I cannot go out with the front tooth removed.
Absolutely, I understand. So I can give you something very immediately. What we can do, we can splint your tooth today, fix it, and then take a mold and get you in the next appointment and take your tooth out and put in your replacement. That would be something known
I
as
will call this, doctor. Yes.
that is a bridge, something called as Maryland Bridge. It has little wings which will be supported by the teeth next to it.
Okay. Is that
Yeah.
going to be made in Maryland?
No, that will be made in lab. So that will
Okay, sorry.
no,
Okay.
absolutely okay. Other than that, what I need you to do is
Doctor, is this is gonna last for long with that temporary option?
the temporary option will be
If this is a
lasting.
temporary option, it's gonna last for long.
It will be lasting for 5 to 7 years, depending on how you're maintaining
Oh
it.
no, doctor. Sorry, doctor. I don't want to say for 5 years now. I really want to really something better than this.
Absolutely, we can get you something fixed
Thank
as
you
well.
very much then. Thank you very much.
Thank you so much.
No, that was great. Then okay, guys, okay, let's listen to our champions first about this. Okay, let's see what they're going to say about this role play. Please, guys, say your genuine opinion about Dr. Sanchari's role play. Look, my opinion is she is perfect communicator. Her communication skills are perfect, amazing. Her thoughts and most of the points very smart way. She used very smart way doing this. Again, she needs to focus. Am I right, doctor?
Yes, yes, Dr. Bedo. Thank you so much.
And what you need to get then to focus? What sort of medicine you need to eat?
What
Fish
should I
oil.
take?
Fish oil, right?
Fish oil, yes.
Did
I
I
take
tell you
fish oil.
before fish oil?
You did, yes.
Okay. Do you know how many times did I ask about the reason for bone loss?
3, 4 times.
Imagine if you have answered this question from the beginning, that should have saved your time. And I shouldn't ask again.
Yes.
Write down the question and answer straight away.
I wanted to gather all the information and give you in a beautiful package.
Yeah, no, but that's okay. It's a dialogue, right? Look, I was happy to do this, but you didn't do it. True?
Yes. Yes.
Okay. Diagnose. Please don't use the old diagnosis system right now, as long as not given in the scenario.
Okay.
And the word, guys, do you think, guys, the word chronic in this case, do you think it's a correct term or not, or incorrect term? Let me check now the champions, what they say on the Facebook. Let me check now all the answers down there. Dr. Sayed mentioned, said, Doctor, you did great. Perfect. You did it nicely. For response to the tricky questions of Dr. Bido. These are the questions you're going to get it either in part one and part two, Dr. Liv.
No, I think they were pretty basic questions.
Yes,
Yes.
you see, these are the type of questions you're going to get either for part one or part two.
Yes.
Because this is the clinical question patient expected to get answered.
I could not reach to this referral.
That's okay. That's you see, that's what I'm saying. You need to touch with things. You don't
Ye-
need really look any unnecessary information, any point that is going to waste time. But everyone is very happy with your role play. Look at this.
Thank you.
Dr. Ramin mentioned she is great and knows things, but she get distracted and instead of answer the counter question, the patient. Yes, Dr. Ramin, I love this, okay? And that's what I always tell her. She needs only focus a little bit. Okay, it is, you see the candidates, what they mentioned, a very smart candidate. Dr. JD mentioned rapidly progressing periodontitis. So, doctor, learn this. We don't use the word chronic anymore. You maybe need to listen to my session yesterday. I made Gigi's class yesterday. You
Mm-hmm.
will find it on the Facebook page. And
Okay.
I actually has described the new classification nicely. And I believe every champion has attended the session. They really know it. Like for example, Dr. Jaslyn. I don't think it's Jacqueline, it's Jaslyn, right? She said progressive. I'm very happy. You see, Dr. Bavia mentioned rapidly progressing periodontitis. Very happy. So, Dr. Maria said incorrect. You see, last session you said staging, doctor. You did very good. Okay, so Dr. Maria now saying this incorrect term, Dr. Sanderi, as due to risk factors, it could be progressing very fast. Did you get now the right answer, Dr. Sanchari?
So, what
So
would be
it
the
is
correct diagnosis, the complete diagnosis?
the complete diagnosis is based on severe type of bone loss. We are now looking for stage 4 and because grade 3 mobility. Once we find one tooth in the mouth with grade 3 mobility or severe bone loss straight away, that's going to be stage 4. And the grade C, what does it mean grade C? Mean rapidly progressing periodontitis, not chronic, because chronic means slowly progressing. Did you get the difference right now?
Okay. Yes, I did. Thank you so much.
Very good then.
My
No problem.
apologies. I should have checked on that earlier.
That's okay. That's okay then. Okay.
Thank you.
Okay. Dr. Yamuna mentioned, great job, doctor, but extraction cannot be done on the same appointment due to uncontrolled diabetes. Okay.
Yep.
That's another thought. You see how smart the candidate? That's another thought. Okay.
Yep.
Okay. Again, great role play. She was so calm. She's perfect in this.
Thank you so much.
Yeah. Can RPD as a treatment option? What do you think, doctor? Dr. Patel ask question. Can RPD be as a treatment option as the patient has poor oral hygiene, smoking, alcohol, and uncontrolled diabetes as a risk factor? Once the healing process is complete, we can do other payment option once the risk factor are under control. What do you think, Dr. Den?
I think because it's a single tooth, we should stick to bridge option. Either we can do a fiber reinforced or we can do a Maryland bridge. Maryland bridge would be more preferred.
I totally agree on this. So now the treatment plan can vary with even one change in the risk factors. One change in risk factor, one change, one change in overall management of the case, it can actually change the whole situation. For example, let's now think about it more clinically. Can you tell me again what's the diagnosis of this case, Dr. Sanchari?
It is stage 4, grade C, rapidly progressing periodontitis.
Perfect. I need you or anyone here can give me a different name for severity part. How we call it for severity part?
For the severe this stage?
Yes, stage 4 and very severe. And then very severe had a time explanation to define what does it mean very severe or grade 4 periodontitis. If someone guys give it, I will give you $2. No, $5 if I see you and you remind me. How we call the based on the treatment option for a stage in stage 4 as very severe, we call something. We call stage 4. This condition has something, or you predict something can happen. And but guys, believe me, that's easy. Can be a question exam. This is part. It can be easy question exam.
Yes.
In stage 3, we say something for the teeth, and then in stage 4, we say something for the teeth. In stage 3, something can happen to the teeth, one or less. And then for stage 4, we say something can happen to most of the teeth.
We will lose teeth.
Thank you. Say it again.
We will lose teeth.
Almost
all of them would
all
be,
of the teeth.
yes.
Right?
Yeah.
Most of the teeth will be lost.
Very severe, yeah.
In which case?
Very severe.
Thank you, Dr. Kiran. Yes, and very severe. What about what about stage 3? One tooth or more, right?
Yes.
So now, in stage 3, we expect when you look at the X-ray, for example, here right now, that's stage 4, right? In stage 3, you will find most of the teeth can be saved, okay? And one or two teeth only need to go. But in stage 4, very severe, most of the teeth need to go.
Yes.
Good. Now, as long as diagnosing this case, most of the teeth need to go. Okay?
Okay.
The question here, which teeth need to go? For example, if most of the teeth is gonna go from posterior, not anterior, you still, my opinion right now, as long as the adjacent teeth can be okay, you still can get either implant or you can get, as you said, Maryland bridge, resin bonded bridge, as long as the adjacent teeth will be existing and you don't need to extract them right now. What if you're going to extract multiple teeth? In this case, what's going to be the best option?
Then we can do a denture for
A
temporary.
flip denture.
Yes.
Flip denture. You can get immediate denture.
Yes.
This depends on how many teeth is going to extract. You get the idea right now?
Yes.
Yes, this is it. Now, that's why the X-ray is very important to tell what exactly need to do. So let's now talk general about, guys, are you ready right now to know about the treatment options? Actually, I was looking the Facebook same times. Here, sorry, guys, I was doing like this when I was explaining. Okay, guys, would you like, guys, right now to know the treatment option, both immediate and the long term, the permanent?
Yes, please.
Okay, you see, I'm very good. Okay, guys, you tell me, guys, what's your options? What are your options this case for immediate replacement options? I see Dr. Zahir mentioned implant supported denture. Yes, it can be an option. right? Depends. Like we'll say implant, definitely. And then immediate denture, Dr. Winnie. E6 retina, Dr. Winnie. RPD, which is immediate denture, Dr. Maria. Dr. Lev, immediate denture. Again, guys, immediate denture. Or any other option based on how many teeth you're going to extract. If only one tooth, I don't need for immediate denture. That's not going to be the best. Okay? Let's now, guys, get this. Okay, options. Immediate options. One, natural tooth reattachment, chop and bond. If it's just only one single tooth, and then you're not going to extract multiple teeth in the same jaw, in this case, what you can do is you can just extract the tooth, and then we chop the root, and then we clean the crown, and then bond it to the adjacent teeth using wire or fiber ribbon. Guys, if you don't know, guys, what's fiber ribbon, you guys just guys like go and check the what we call it as resin modified ribbon. Okay, that's one option. Other option is, what is the good about this? Perfect color, shape match, completely free, no lab fees, feels natural, can made in same day. Patient will go out from the clinic with a tooth attached. Cons, temporary. The natural tooth can become brittle and discard over time. That's why we just only, for static purpose, we use this for static, not for function. Guys, is the first option clear right now to you guys? Dr. Sanchari, is the first option clear to you?
Yes, Dr. Bedo.
Very good then. Guys, are you happy, guys, with this option, everyone? Dr. Zahir mentioned, I am aware, which I'm very happy. Guys, by the way, we're going to discuss, do you know that we started right now to put you in Telegram group slowly, everyone, and also we put you in part 1, okay? And also we put you right now in Google Drive because there is a big surprise in this course right now. I'm working it takes a bit of time. It gave me a big surprise because next week we're going to start the course. So guys, we'll know about all this stuff. Dr. Shama said yes, you are aware. Dr. Ramin, yes, you are aware. Very good. The second option, fiber reinforced resin bridge. Resin, it's actually acrylic and resin. We use it sometimes away. The process, a pre-made acrylic tooth is bonded to adjacent teeth using a high-strength ribbon. Guys, do you know, guys, what is ribbon, guys, or not? I can show it to you. What is a ribbon if you don't know. So you get a made acrylic, you know, guys, in denture, in our clinics, we actually have replacement acrylic teeth just in case if someone was broken denture or maybe one tooth of the denture been fallen, so we can get this acrylic tooth, right? And then we can attach it back again to the denture, the same tooth, you're gonna get it. Plus you get a ribbon, and then you put the ribbon on the lingual surface of the teeth, and then attach this acrylic to the ribbon, white soft, and then like you the ribbon, things will be perfect. Easy now, guys, option? Very fast, very fast. Easy. Can snap if you bite a nut. Again, more static, not function. What is the third option? Dental flipper, acrylic plate. When? Normally, when there is more teeth extracted. And this is most affordable option, right? And this is going to protect the wound to heal as well. You can use it in this case, given that patient has diabetes and also the patient is smoker. But the best for me so far, to be quick and easy, the first option. Second option, second best. The third option, if you have multiple teeth extracted. A6 retainer, you guys mentioned about this. But the problem with A6 retainer, you really need a lab in it. Mostly need a lab, or otherwise you can do it in your like in by yourself in the lab if you have a lab in your clinic. Immediate replacement options: dental implant, either pure implant for one tooth or multiple teeth extracted will be implant supported bridges. But this patient has bone resorption, especially on the front tooth. So that's not my suggestion right now. If you're gonna get question exam with a case that there is severe bone resorption in a tooth, and they ask you what is the best option, don't say implant. Why? Because in this case, implant will not be the best. Because what happens is you really need to get bone top up in this case. And the success can be okay, but not as if you gave, for example, Maryland bridge. Why? The good thing about Maryland bridge is statically acceptable, functionally acceptable. It can last 15 years. Yes, guys, it can last 15 years. I swear in God, it can last 15 years. If you have reading books before 5, 7 years only, I think this books need to change the information because all the recent evidence-based references right now mention that it can last for a long time, 15 years even and more. Guys, did you know this information before? That Maryland bridge can last 15 years even more. Let me check now the answers from our champions.
Most likely before part 1.
Which one?
Before part 1, when you used to discuss prostho. Now I remember.
Now remember?
Yes.
Okay, I'm happy you remember right now.
Thank you, Dr. Bedo.
No problem. Okay, guys, please, guys, update your knowledge and information about this part. Maryland Bridge, it can last for a long time. It can last for 15 years. Okay? Yeah, we used to say before 5 to 7 years only, but now you can say 7 to 15 years. Go, please, guys, and check on this. You will find very good articles, even Australian-based articles like Australian Dental Journal and stuff. They discuss this as a permanent option, not anymore as a only temporary option for sometimes, especially for the front teeth. Okay. Now, the second option. The third option, traditional fixed bridge. Again, in this case, we should have okay, guys. I think the admin's trying to help you to send you to ribbon technique, but for some reason, I don't know why not allowing them to do this. Okay, anyone else, guys, please, if you can, if please, guys, can send this, like from the admin, if you can send this photo, will help all the candidates. You know what? I can send it even by myself on the page on the group. Now, traditional fixed bridge, yes, only if the adjacent teeth are sound and strong enough. But do I recommend that the first option? Not really. I love Maryland bridge. Minimal, we call it this way, minimal preparation, resin bonded bridge. So it means we take the strength from the resin rather than preparation. And that's the best. I love it. Very, our first is cheap, two, conservative, three, last for a long time. Even if it's going to bond, this like debonded, we just only re-cement it back again. Patient can live with another 15 years until the patient dies. Things are good.
Perfect.
Yes. Chrome denture, which one we mentioned before. We can get metal denture, a metal-based chromium denture. And this is actually acrylic denture. And this actually, if you have multiple teeth, extracted. Guys, how we feel about this session right now? Do you learn something new today? Dr. Sanchari, what do you think?
Yes, absolutely. It was really good to do a role play with you. I need more of these. Very helpful.
But what you need to do, I'm very happy, by the way. But what you need to do, doctor,
More role plays, and I need to read more and focus.
read more, right? And
Yes.
focus, please. That's what I always say. Please, you need to focus as well. Give me, guys, 1 second. I will look. I will, guys, giving you this repon. Give 1 second. I will help you with the repon right now. Give 1 second, please, guys. Because the admin tried to give it to you guys, the photo, but they wouldn't. I don't know, for some reason they couldn't. Okay, 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 okay. Okay, guys, I think the admin even got better than this, maybe, but this can give you some ideas. Okay, guys, can you share? Guys, can you see the screen right now? My screen? That's a guy's a repon.
Yes, Dr.
It's
Bedo, I
like
can
a
see it.
pen. Can you see right now?
Yeah.
It's composite somehow. It's composite, but it's soft composite. You just attach it to the adjacencies from the back, and then you may use the same tooth. You extract it, cut it, and then it's still soft. Attach with composite to the same tooth, or you can get acrylic tooth. You can build up another tooth as well on top of this, and then cure it with like you. Perfect, done, amazing. Okay, that's the one like this
Yes.
or this. This soft. You see the ribbon is still soft. The dentist now attach the ribbon on that on the palatal surface, and then they're gonna put the tooth from the front, either acrylic or the same tooth. Guys, I was very happy, guys, seeing you today. You know what? If you want a really session tomorrow, let me know and tell me what's the topic. I can put the post on our Facebook group or maybe the page. And then, guys, you tell me what exactly you want to discuss tomorrow. We can discuss it together. We still have lots of good topics we really need to discuss. Guys, I'm very happy, guys. I really, guys, don't want to leave you, guys, because I miss you very much, right?
Thank you so much, Dr. Bedo.
It's Dr. Sanctuary, right?
Yes, it was a beautiful session. Thank you so much.
No, bro, Dr. Sanctuary, then. I just remember something now. That's it. Okay. Thank you very much, you guys. Have a great night. See you then tomorrow, maybe, if you're really happy to have session tomorrow. Thank you, Dr. Sanctuary. Thank you, every one of you guys.
Thank you so
Have
much,
you all
Dr.
the
Bedo.
best. Thank you very much.
Have a great
Bye
night.
bye. Thank you. Bye bye bye. Thank you. Have a great night, guys, every one of you. Okay, I see the comments here right now. Let me check this. Yes, sir. Can we do a version for? I love this. Okay, Dr. Neshma. Guys, as long as guys you are motivated, I'm very happy to do it. Can we do a version or RPD design? Whatever you like. I can do a post today. And you please guys tell me. Chair side, we can do it. Yes, sir. Yes, Dr. Riti, I do it for you. Yes, Dr. Maria, thank you. Dr. Shama, thank you, Dr. Bill. Thank you very much, Dr. Shama. You guys, my candidates, you are my champions. You are the best souls in this world. Yes, Doctor, tomorrow will be great. Yes, I can do it. Why not? I love to help you. We can complete new classification. Oh yeah, you're right. Good. We can do new classification or a Vulcan. Miss you, Dr. Bidu. Dr. Lakshmi, I miss you very much. Big, big heart to you, Dr. Lakshmi. Let me just give you a big heart. Thank you very much, Dr. Lakshmi. I miss you too. Thank you very much, Dr. Lakshmi. We miss you all. I believe this, Dr. Adam. Dr. Adam, talk to Dr. Adam. Dr. Sayeda, thank you, Dr. Bidu. Thank you, Dr. Sayeda. And by the way, you're doing great. I follow up on you and I see you and you're doing great, Dr. Sayeda. Dr. Ramin, thank you, Dr. Ramin. Doctor, can we continue tomorrow with periodontal staging and grading? I love to do this. Why not? Dr. Winnie, thank you, Dr. Bido. Dr. Riti, Thank you very much, Dr. Nishma. Thank you, Dr. Mariam. Thank you, Dr. Zina. Thank you, Dr. Natalie. Thank you, Dr. Joy. Have a great night, every one of you guys. See you tomorrow then. This is Dr. N? Okay, Dr. Dr. Adam and Dr. N together in one account. Thank you very much, Dr. N. Thank you, guys. Dr. Winnie, I like the way. Say again, please, let's read this. Oh, it's getting chopped. I don't know why. I like the way you lecture, doctor. You ask question about the lecture you taught yesterday. This help us to remember things easier. Take care, VM. Thank you. I learned it last time. TQ, it doesn't mean take care. It means thank you. And VM means very much. Now I got it. Thank you very much. Thank you, Dr. Winnie, very much. You see, I still remember things. Thank you, Dr. Ann. Thank you, Dr. Shiva. Thank you, Dr. Patel. Thank you, Dr. Jaslin. It has wings on the tooth that need to be replaced. Yes. Thank you, Dr. Reddy. Have a great night. I post now on our Facebook group, guys. My morning routine is to start. My morning routine, Dr. Magda, is to start the day with Dr. Bedo. I love your sessions, doctor. Thank you thank you for being here with us every day. Thank you, Dr. Magda. It's my pleasure always. Look, you are a big part of my life. Thank you very much. Yes, you're right, doctor. You're right, doctor, about this. Dr. Jaylan, you're right. Thank you very much, guys. See you tomorrow then. I will be announced for the session. Thank you. Bye bye. Have a great night. Bye bye bye.